Hi, I'm back again. The last series was about the types of treatments available for autism spectrum disorder, ASD. ASD cannot be cured, but treatment can reduce symptoms that interfere with daily functioning and quality of life. There are a few treatments that provide for people with ASD, which are behavioral approaches, developmental approaches, educational approaches, social relational approaches, pharmacological approaches, psychological approaches, and complementary and alternative treatments. Behavioral approaches. Behavioral approaches are the most evidence-based for treating ASD symptoms. They have become widely accepted among educators and healthcare professionals and are used in many schools and treatment clinics. These treatments are called Applied Behavior Analysis, ABA. In ABA, there are two styles, Discrete Trial Training, DTT, and Pivotal Response Training, PRT. Discrete Trial Training, DTT, uses step-by-step instructions to teach a desired behavior or response. Lessons are broken down into their simplest parts, and desired answers and behaviors are rewarded. For example, give a high five as a reward when the kid responds to the instructions. Pivotal Response Training, PRT, to improve a few pivotal skills that will help the person learn many other skills. For example, to initiate communication with others. Developmental approaches. In developmental approaches, there are two types, speech and language therapy and occupational therapy. Speech and language therapy can help people improve their understanding and use of language and speech. Some people with ASD communicate verbally. In occupational therapy, we teach skills that help the person live as independently as possible. Occupational therapy can also include sensory integration therapy and physical therapy. Sensory integration therapy to help improve responses to sensory input that may be restrictive or overwhelming. For example, listen to music. In physical therapy, to help improve physical skills such as fine movements of the fingers or larger movements of the trunk and body. For example, roll the body toward the ball. Educational approaches. In educational approaches, lessons are given in a classroom setting. Teach is an idea for people with autism who thrive on consistency and visual learning. For example, daily routines can be written or drawn and placed in clear sight. Social relational approaches. In social relational approaches, treatment focuses on improving social skills and building emotional bonds. Some social relational approaches involve parents or peer mentors. There are four types: developmental, individual differences, relationship-based, also called floor time, relationship development intervention, RDI, social stories, and social skills groups. Pharmacological approaches. Pharmacological approaches, there are no medications that treat the core symptoms of ASD. Some medications treat co-occurring symptoms that can help people with ASD function better. For example, medication might help manage self-harming behaviors such as headbanging or hand biting. And medication can also help people with ASD manage psychological conditions such as anxiety or depression. It is important to work with a doctor who has experience treating people with ASD when considering the use of medication. Psychological approaches. Psychological approaches can help people with ASD cope with anxiety, depression, and other mental health issues. Cognitive behavioral therapy, CBT, is one psychological approach that focuses on learning the connections between thoughts, feelings, and behaviors. Complementary and alternative treatments. In complementary and alternative treatments, some individuals and parents use this treatment because other categories do not fit their children. Complementary and alternative treatments are often used to supplement more traditional approaches. They might include special diets, herbal supplements, or arts therapy. Individuals and families should always talk to their doctor before starting a complementary and alternative treatments.